Let us start with another high yield question. So this is a 35 years old man who is having recurrent episodes of dysuria, which is difficult urination, and pelvic pain over the past 2 years, which is quite a long history. So you can see he's having these episodes for the last 2 years, and he's sexually active. Examination shows a tender prostate. This is very specific for uh, prostatitis, and urine analysis shows 2 to 5 WBCs, which is normal. This is non-significant, and urine culture is negative. Culture is negative. Which of the following is the most likely cause? So at this time, think of a likely answer and give the answer. So the answer is chlamydia trachomatis. Option B is the correct answer. So why option B is correct and why the rest of the options are incorrect? So first of all, this patient is sexually active and he's a young person, right? So this patient is having uh, chronic prostatitis because the history is for 2 years. This patient is having these episodes uh, for 2 years. So this patient is having chronic prostatitis, and we have to identify the microorganism on the basis of the person who is having the age of the person who is having the prostatitis. So if you see chronic prostatitis, I'm not talking about the real case scenario. I'm just talking about the board questions. I'm talking about USMLE. So in USMLE, if you see that it's 65 years or 60 years old man is having prostatitis, you must think of E. coli and not the uh, trachomatis or Neisseria gonorrhoeae. Why? Because the young patients, they're usually not very careful or cautious about their sexual contacts. So they end up getting some sexually transmitted infections, and in those patients, the most likely answer or the option would be related to sexually transmitted microorganisms such as chlamydia, such as Neisseria gonorrhoeae. But in the older population, you should choose E. coli instead of chlamydia and Neisseria gonorrhoeae. So this is a young and sexually active male who is having dysuria and pelvic pain for the past 2 years. So the most likely answer here is chlamydia trachomatis. And it is important to mention that the culture is going to be negative in case of infection because of the chlamydia or Neisseria gonorrhoeae, because Neisseria gonorrhoeae is a fastidious organism. It requires a specific culture media to grow. Similarly, chlamydia is an intracellular organism. So usually the culture is negative for chlamydia. So a negative culture doesn't rule out the infection. So it is important to mention that if the culture is negative, you should think of chlamydia or Neisseria as the etiology. And why the chancroid or option A is incorrect? Chancroid is caused by Haemophilus ducreyi, and Haemophilus ducreyi is a very painful infection, and it presents with a very painful and deep ulcer formation on the genitalia, and this is not the case here, so you can rule out option A. Herpes simplex can cause dysuria, difficult micturition, and it also results in the development of vesicles and shallow ulcer formation on the genitalia. And this is not the case here. And furthermore, the patient would be having multiple uh, shallow ulcers and vesicles. So these are not the exam findings here. So you can rule out herpes simplex. And primary syphilis is going to present with a painless rather than painful. This patient is having pain, but syphilis is going to be painless. painless ulcer formation on the genitalia, and it is going to develop into secondary syphilis and tertiary syphilis. So this patient is having symptoms for 2 years, and obviously by the end of 2 years, the primary syphilis would result in secondary syphilis and tertiary syphilis, and it would involve the cardiovascular system and also nervous system. And this patient is not having any cardiac or CNS involvement, so you can rule out syphilis too. And Trichomonas vaginalis, again, a very high yield microorganism for board exams, but it is more common in the females and it causes cervicitis. And it is again a sexually transmitted infection, but it is more common in the female and it results in the Strawberry cervix or acute cervicitis, and it is not going to present like for the consecutive 2 years. And in most of the cases in males, it is usually asymptomatic, and they are just symptoms free. And it is important to mention that males get this infection, and that is Trichomonas vaginalis, by having a sexual intercourse with a female who is having infection with Trichomonas vaginalis. So they are carriers, and you have to treat both the female and the male. So if the female is having an infection with Trichomonas vaginalis, you also have to treat the partner. So it is important because some of the questions I encountered, they tested on this concept that you have to treat the partner too, sexual partner too, along with the patient.